there are many places. If you look in the internet, you have many schools and many places who give you education like correspondence and things, but you have to be very careful in what you choose. It has to be some place where the government recognizes, because no use after spending so much money and studying for so much, and when you get a piece of paper, a certificate, and you take it to someone and they say, oh, we don't recognize this. So that is very important. There are several areas, and this is why we have a modular system, and we break it by each year. We have certain competencies from very basic to intermediate to advanced. So in the first year is the basic competencies of Ayurveda, which we cover the basic principles, the anatomy, physiology, the communication skills, the counseling techniques, then the principles, philosophical principles of Ayurveda. And when it comes to the second year, which is intermediate, we go beyond that. We cover the pathology, the Western pathology. We integrate it into Ayurvedic pathology as well as the herbs. And when we come to the third year, it's much more advanced. We consider the medicine, Ayurvedic medicine, the Kaya Chikitsa, and the Ayurvedic etiology, and research methods. It's another important area. If we want to move forward, evidence-based research is very important. So in order to have evidence-based research, we must have a good documentation system. And that's what we emphasize. So you take down notes, so when another person looks at it, he will immediately know what you have written, so he can use it for the research purposes. But many times, we as Ayurvedic physicians have not been very good at that. We know in our mind what it is good for. We make a few notes. But if another person who doesn't know the patient at all comes and reads that, he has to think a lot. But not in the Western system, because I work between both of them. In the Western system, there is a case history sheet. They do meticulous history taking, and anyone comes, knows the whole history. And so not the same doctor, another person. So that is a system we have to try and adopt. And that is a step forward to do research. And evidence-based research is very, very important. And that is what is moving forward. Because medical systems are becoming very, very expensive. If there is no evidence of efficacy, that it is doing something good, then the government is not willing to pay for it. So research is another important aspect which we cover in the year 3. And then in the year 4, we have developed the research further into a dissertation where you have to actually do a research. And then we do the specialist areas in Ayurvedic medicine, things like Panchakarma, things like advanced Kaya Chikitsa, Kaumara Bhritya, the women's health, and certain areas of law. Legal issues are very important. Because another important thing as an Ayurvedic practitioner is to recognize our limitations. We got to know, according to the law, what can we do and what can't we do. If there is something comes up, then what are we going to do? We must know how to refer them to the proper authorities. Several times I get cases of appendectomy, appendicitis, who have pain in the point. Yeah. And appendicitis is something that Ayurveda should not touch. Because if we try to give some medicines and send them home, it will become worse and they might kill the patient itself. So we must be able to diagnose that as appendicitis and then refer them immediately to the hospital. There they have the surgery. And I have done several cases like that. And there are certain cases, they come back from the hospitals, back to the Ayurvedic peoples. There are certain chronic ailments. We are very, very good. There are certain skin diseases, problems. I get a lot of them coming. A lot of people come after post-cancer diagnosis. And very little Western medicine can do in these areas. But Ayurveda can, because Ayurveda looks at the whole picture, the whole person, not just give the drug to that diseased part, but also train the person to think differently and take charge of their health. heal themselves is most important. You are also your physician. You know your body better than a physician. We only know what you tell. If you don't tell us, we don't know, to be honest. So it's very important that you build that rapport with your physician and you take charge of what you are doing. Your willpower is very important. Your mind is very, very, very strong, very important on how you're going to treat yourself. A lot of patients come down, sit down, they listen, everything. When they go back home, they have so many other pressures, so many other issues and problems, and they are not able to do. And that's another important area where a physician should recognize. What are the limitations? It happened a lot of time to me in my own clinic. Because we are trained in India or Sri Lanka, we know most of the herbs or the food and items on what is available, very common in India. One example is mung dal. You know, nowadays a lot of people know what mung dal is, or green gram. Mung dal, it's a lentil. It's a green color. Mung dal. So I had a client, a patient who came, which I put them on a mung dal soup, which is a very cleansing and a very light diet, which it's good to detox themselves. So I said, yes, you better go and get some mung dal and take this, make it like a soup and have it twice a day and don't drink anything, just warm water for 2 weeks and then come back to me. So she went home and she came back 2 weeks later and she still has the problem. I asked her, did you get the mung dal? I can't find, I don't know what it is. She has gone to Saint's big department stores and asked for mung dal, they don't know. And she couldn't do it. So it's when now I take a packet with me and show it to them. Then, oh yes, that's right. So it's quite important that you make them realize or understand not only the medicine, the food and the way they're living, you got to give a good rationale. Only you will do things if you accept it, if you feel that it is going to help me. If you don't feel that it is going to help me, you will just listen and you'll say thank you very much and go home and don't do it. So these are very important things that we train our practitioners at certain levels, how to counsel, how to communicate is more. Because when we are dealing with people, and not to make any judgments, a lot of the time in a patient-physician relationship, a lot of people make judgments. They think, oh, it's not a good person, it's not right or not wrong. No, smoking, people come with smoking, people come with alcohol. We know it is bad, but we can't treat them as a bad person. The person is not bad. The person is good, but their habit is bad. So we got to try something about their habit and bring out the bad points in their habit and then ask them to break that habit, not to label them as a bad person because they are smoking or because they are drinking. So these are certain areas where as practitioners we teach them. Yes, there are basic levels as we go up, we built in our program.
Ja bih samo htio reći za kraj, kao što je doktor Tik rekao, znači svaka zemlja moramo napraviti jedan, da tako kažem, 40 do 50% znači onoga temeljnog ayurveda je ujednačeno u svim europskim zemljama. Ono što je specifično, ono lokalno što se tiče, znači u ovom slučaju Hrvatske, radi se programi i to bi trebalo 9. mjeseca početi sa tim trogodišnjim studijem. S obzirom, znači mi ćemo to prilagoditi što se tiče naših lokalnih uvjeta, zakona i svega ostaloga. Znači. Internet link može svako ići, znači Ayurveda College UK, znači to može svako ići. Znači ono što ćemo mi imati, mi ćemo po Bologni, znači sustav, diplomski sustav, to bi bio prvostupnik u Hrvatskoj po novom nazivu, to je takozvani bachelor degree, to je bilo 3 godina i tu bi ljudi diplomu dobili. Znači mi ćemo to, dobit će istu edukaciju koju imaju u Londonu. Što se tiče kredita, ono što je on govorio, znači, ali će biti malo prilagođena našoj lokalnoj sredini. Da, tako, znači lokalnoj sredini. I što je jako bitno, ta diploma će biti jednog dana kad uđemo, daj Bože, mislim, ne znam sad da li je Bože, ne znam, uglavnom, kad uđemo u Europsku zajednicu, ako niš drugo možete ići raditi u London.
Internet link is you can go is www.ayurvedacollege.org.uk, or you can go to www.mdx, which is a middlesex.ac.uk. You get a lot of information on those two.
University,
and stroke Ayurveda, then you get into our